Excuse me, Dr. Hussain, we can't listen you. Unmute yourself.
Yes, ma'am. Bismillahirrahmanirrahim. According to Prophet Muhammad sallallahu alaihi wasallam, richness is not having many belongings, but the richness is the contentment of the soul. I am Dr. Hussain Mahmood. Today I am presenting assessment of nutritional status under kind supervision of Professor Dr. Saira Afzal. Learning outlines. Introduction, assessment method and direct, indirect, anthropometric method, biochemical laboratory method, clinical methods, dietary evaluation method, and recent advances. Learning outcomes. By the end of this presentation, participant will be able to describe the introduction, assessment method, direct, indirect, anthropometric methods, biochemical laboratory methods, clinical methods, dietary evaluation method, and recent updates. Introduction of nutrition status. The nutritional status of an individual is often the result of many interrelated factors. It is influenced by food intake, quantity, quality, and physical health. The spectrum of nutritional status spread from obesity to severe malnutrition. Nutritional status of community is the sum of the nutritional status of individuals. This is the introduction to define the nutritional problem of the targeted population. It is necessary to measure the nutritional status. Nutritional status assessment enables to determine whether the individual is well nourished or undernourished. First of all, assessment of the nutritional situation in target population leads to analysis of the cause of problems and then action. Action based on the analysis and available resources. An ideal nutritional status occurs when the supply of nutrients conforms to the nutritional requirements or needs. This is the balance of nutritional intake and the requirements. Diets are rated in quality according to the balance of nutrients they provide and not solely on the type of food eaten or the amount of caloric intake. People can be optimal nutritional status or they can be under, over or malnourished. The first picture shows us where underweight is undernourished and in middle healthy baby optimal nutritional status. In last morbid obesity overnourished. Objective of nutritional assessment to obtain precise information on the prevalence and geographical distribution of nutritional problem of a given community, to identify individual or population groups at risk of becoming malnourished, identify individual or population groups who are malnourished, to develop healthcare programs that meet the community needs which are defined by the assessment, to measure the effectiveness of nutritional program and intervention once initiated. Assessment method. Two types of method, direct and indirect. The direct method deals with the individual and measures objective criteria. The indirect method uses community health indices that reflect nutritional influences. Direct method of nutritional assessment is summarized as ABCD: anthropometric method, biochemical laboratory method, clinical method, and dietary evaluation methods. The indirect method of nutritional assessment include three categories: ecological variables, including crop production, economic factors, per capita income, population density, and social habits; vital health status, particularly infants and under 5 mortality and fertility index. Direct method of nutritional assessment. Clinical assessment. It is an essential feature of all nutritional survey. It is the simplest and most practical method of ascertaining the nutritional status of a group of individuals. It utilizes a number of physical signs specific and non-specific, that are known to be associated with malnutrition and deficiency of vitamins and micronutrients. Clinical assessment. WHO expert committee classified signs used in nutritional survey into 3 categories: not related to nutrition, pterygium, alopecia, and pyuria, that need further investigation. For example, macular pigmentation, corneal vascularization, geographical tongue. Non-TB value, angular stomatitis, bite or spot, cough, tenderness, absence of knee and ankle jerk, beriberi syndrome, enlargement of thyroid gland, endemic goiter. This picture show vitamin A deficiency, show bite or spots in eye, xerophthalmia. In beriberi syndrome, vitamin B1 deficiency, ankle and knee jerk loss. In vitamin, this is the picture of vitamin B2 deficiency, and the third one picture is Plagra vitamin B3 deficiency, clinical diagnosis, dermatitis, diarrhea, dementia, and death. This is vitamin C deficiency, scurvy, gums bleeding. This is rickets, vitamin D deficiency, bowing of legs. This is protein allergy malnutrition, shows marasmus and Kwashiorkor disease. This is iodine deficiency disorder, goiter. 8 signs of vitamin B12 deficiency: pale skin, weakness and fatigue, tingling and head and feet, difficulty in walking, mouth ulcer and glossitis, disturbed vision, mood changes, breathlessness and dizziness. Clinical assessment. Good nutritional history should be obtained. General clinical examination with special attention to organs like hair, angles of the mouth, gums, nails, skin, eye, tongue, muscles, bone, and thyroid gland. Detection of relevant signs help in establishing the nutritional diagnosis. Example of illness caused by the improper nutrient consumption. Too little nutrient consumption cause protein allergy, malnutrition, anemia, osteoporosis, goiter, xerophthalmia, beriberi syndrome, scurvy, and rickets. Too much nutrient consumption cause stroke, heart and arterial diseases, some cancer, obesity, diabetes mellitus, gallstone, dental caries, and gout. Advantages and limitation. The advantage is fast and easy to perform, inexpensive, non-invasive. The limitation include did not detect early cases, malnutrition can't be quantified on the basis of clinical sign. Many deficiencies are unaccompanied by physical signs, lack of specificity and subjective nature most of the physical sign. Anthropometric method. Anthropometry is the measurement of body height, weight, and proportion. It is an essential component of clinical examination of infant, children, and pregnant women. It is used to evaluate both under and overnutrition. To measure value reflects the current nutritional status and don't differentiate between acute and chronic changes. Other anthropometric methods: mid-arm circumference, skin fold thickness, head circumference, head-chest ratio, hip-waist ratio. First of all, length. A wooden measuring board, also called sliding board, is used for measuring the length of children under 2 years old to the nearest millimeters. Measuring the child lying down always give the reading greater than the child's actual height by 1 to 2 centimeters. This is a picture shows measuring of height under 2 years of age. Measuring of weight. The height measured with the child or adult in standing position using children who are 2 years of age or more. Head should be in Frankfurt position, a position where the line passing from the external ear hole to the lower eyelid in parallel to the floor. The shoulder, buttocks, and the heels should touch the vertical stand. Either a stadiometer or portable anthropometer can be used for measuring. Measurements are recorded to the nearest millimeter. This picture shows measurement of height over 2 years of age. Anthropometry weight, a weighing scale spring balance, also called the Salter scale, is used for measuring the weight of children under 2 years old. The nearest 0.1 kg in adult and children over 2 years old. A beam balance is used and measurement is also the nearest 0.1 kg. In both cases, a digital electronic scale can be used if you have one available. Don't forget to readjust the scale to 0 before each weighing. You also need to check whether your scale is measuring correctly by weighing an object of known weight. This is the picture showing measurement of weight. Head circumference, measurement of the head along the supraorbital ridges anteriorly and occipital prominence, the prominence area on the back or part of head posteriorly. Measured using flexible, non-stretchable measuring tape around 0.6 cm wide. Head circumference is useful in assessing chronic nutritional problem in children under 2 years old as the brain grows faster during the first 2 years of life. But after 2 years, the growth of the brain is more sluggish and head circumference is not useful. Measurement of the head circumference. Converting measurement to indices. An index is combination of two measurement or one measurement plus the person ages. Weight for age. It is an index used in growth monitoring for assessing children who may be overweight. You assess weight for age of all children under 2 years of age. You carry out your committee-based nutrition active every month. Height for age is an index used for assessing stunting of chronic malnutrition in children. Stunted children have poor physical and intellectual performance and lower work output, leading to lower productivity at individual level and poor socioeconomic development at the community level. Body mass index is the weight of the child adult in kg divided by their height in meters squared. Birth weight is weight of the child birth and classified as follow. Birth weight is more than 2500 grams normal birth weight. Birth weight is between 1500 and 2499 grams low birth weight. Less than 1500 grams is very low birth weight. Weight for age, weight of the child over weight of the reference child of the age, same age multiplied by 100. Weight for height, weight of the child, weight of the reference of child of the same age multiplied by 100. This is index, cutoff value and indication. The weight for age is less than 2 or more than 3, moderate underweight. Weight for age is less than 3, severe underweight. If height for age is less than 2 and more than 3, moderate acute malnutrition. It's if height for age less than 3 and bilateral pitting edema, severe acute malnutrition. Interpretation of BMI for adult. For adult 20-year-old age, BMI is interpreted using standard weight status categories that are the same for all age and for both men and women. If BMI is less than 18.5, underweight is BMI is between 18.5 say 24.9 is normal, 25 say 29.9 is overweight, if 30 and above is obese. Anthropometry. Waist hip ratio, waist hip circumference is measured at the level of umbilicus to the nearest 0.5 centimeters. The subject stand erect with relaxed abdominal muscle, arm at the side and feet together. The measurement should be taken at the end of normal expiration. Waist circumference predict mortality better than any other anthropometric measures. Waist circumference predicts mortality better than other anthropometric measures. In level 1, males less than 94 centimeter, females more than 80 centimeter. In level 2, males more than 102 centimeter and females more than 88 centimeters. Level 1 is the maximum acceptable waist circumference irrespective of the adult age, and there should be no further weight gain. Level 2 denotes the obesity and requires weight management to reduce the risk of type 2 diabetes and serious complication. In 2001, the National Cholesterol Education Program Adult Treatment Panel 3 provide a definition for metabolic syndrome. The NCEP criteria are practical for physicians to use since the variable defining metabolic syndrome are commonly available in clinical practice. Ford et al. Have previously shown that metabolic syndrome is common in people more than 50 age since glucose intolerance is important of the metabolic syndrome and increase with age. This report will focus on the interaction among metabolic syndrome, hyperglycemia, and prevalence of chronic heart disease. Third National Health and Nutritional Examination Survey data shows waist circumference more than 88 centimeter in females and 101 centimeter in males is significantly associated with chronic heart disease. Hip circumference. Hip circumference is measured at the point of greatest circumference around the hip and buttock to the nearest 0.5 centimeter. The subject should be standing and the measure should squat beside him. Both measurements should be taken with the flexible, non-stretchable tape is close contact with skin but without indenting the soft tissue. Interpretation of waist-hip ratio. High-risk waist-hip ratio is more than 80 for females and 0.95 for males. Waist measurement more than 80% of hip measurement for women and 95% for men indices central obesity and considered high risk for diabetes and serious disorder. A waist-hip ratio below these cutoff value is considered low risk. Anthropometry. Two major sources of anthropometric information are demographic and health survey, multiple indicator cluster survey. 4 main data collection methodologies that provide anthropometric information are repeated survey, growth monitoring, sentinel site surveillance, school census data. Advantages of anthropometry. Objectives with the high specificity and sensitivity. Measures many variables of nutritional significance. Height, weight, neck, hip circumference, skin fold thickness, waist and hip ratio, and BMI. Reading are numerical and gradable on standing growth charts. Reading are reproducible, non-expensive, and need minimal training. Limitation of anthropometry, inter-observed error in measurement, limited nutritional diagnosis, problem with reference standard, local versus international standard, arbitrary statistical cutoff level for what considered as abnormal values. Dietary assessments. Dietary assessment. Nutritional intake of human is assessed by 5 different methods. These are 24-hour dietary recalls, food frequency questionnaire, dietary history since early life, food diary techniques, observed food consumption. 24-hour dietary recalls. 24-hour dietary recalls, a trained interview asks the subject to recall all food and drink taken in the previous 24 hours. In the quick, easy, and dependent on short-term memory, but may not be truly representative of the person's usual intake. Second is food frequency questionnaire. In this method, the subject is given a list of around 100 food items to indicate his or her intake frequency and quantity per day, per week, per month, It is expensive, more representative, and easy to use. The limitation of food frequency questionnaire, long questionnaire, error with estimating serving size, need updating with new commercial food product to keep pace and changing dietary habits. The next is diet history. The diet history aims to discover the usual food intake patterns of individual over a relatively long period of time. It is an interviewer method composing of two parts. The first part establishes the overall eating pattern and include a 24-hour recall questions such as what did you have your breakfast yesterday, coupled with what do you usually have to breakfast, following through the entire day in the way subjects are asked to estimate portion size in household measures with the aid of standard spoon of cups and cups, food photographs and food noodles. Next is diet history. The second part is known as the cross check. This is detailed list of food that are checked with the subject. Question concerning food preference, purchasing, and the use of each food served to verify and clarify information given in the first part. Question about purchasing can also provide a check on portion estimation. Next is diet history. The diet history has advantages over other method that estimate nutrient intake over a long period of time. Its disadvantages are that it takes about 1 hour of careful questioning and the interviewer must be nutritionist or dietitian experienced in obtaining diet history. The most common fault of an inexperienced interviewer is probably that sluggish suggests answer. Next is food diary. Food intake types and amounts should be recorded by the subject at the time of consumption. The length of collection period ranges between 1 and 7 days, reliable but difficult to maintain. Next is observed food consumption. The most unused method in the clinical practice that is recommended for research purpose. The meal eaten by the individual is weight and content are exactly calculated. This method is characterized by having a high degree of accuracy but expensive and need time and effort. Interpretation of dietary data. Qualitative method using the food pyramid and the basic food groups method. Different nutrients are classified into 5 groups: fat, oil, bread, cereal, milk products, meat, fish, poultry, vegetables, and fruit. Determine the number of servings from each groups and compare it with minimum requirements. Questionnaire method. The amount of energy and specific nutrients in each food consumed can be calculated using food consumption composition table and then compare it with recommended daily intake. Initial laboratory assessment. Hemoglobin estimate is the most important test and useful index of the overall state of nutrition. Beside anemia is also tells about protein and trace element nutrition. Stool examination for presence of ova and intestinal parasite. Urine dipstick and microscopy for albumin, sugar and blood. Specific lab test measurement of individual nutrition in the body fluid, serum retinol, serum iron, urinary iodine and vitamin D. Detection of abnormal amount of metabolites in the urine creatinine, hydroxyproline ratio, analysis of hair, nail, and skin for micronutrients. Biochemical method, advantages of biochemical method, it is useful in dietary detecting early changes in body metabolism and nutrition before the appearance of overt clinical sign. It is precise, accurate, and reproducible. Useful in to validate data obtained from dietary method. Limitation of biochemical method. Time consuming expensive, they cannot be applied on large scale, need trained personnel and facilities. Then recent updates. This is the article Anthropometric indices and measures to assess the changes in the nutritional status of the population, a systematic literature review. This article aims, therefore, to compare the preference of different anthropometric indices measurement for the detecting change in the nutritional situation in the at population level. Second, discuss their properties and appropriateness is useful in surveillance system. A number of measures and indices such as weight for height, length, tricep skin fold, and middle upper arm circumference perform well in the detection of short-term changes in the nutritional situation of a population. Height, length for age respond to the most of the long-term changes. Most appropriate measure to index identified middle upper arm circumference as one of with the greatest net benefits. The best measurement to detect short-term changes in the nutritional state of population. This should receive higher priority in surveillance system. And MCQs. MCQ number 1, nutritional status of community is the sum of the nutritional status of individual. Indirect method of nutritional assessment is anthropometric method, biochemical laboratory method, ecological variable method, dietary evaluation method, and clinical method. It's C, ecological variables. MCQ number 2, a 35-year-old woman present to clinical today for a yearly physical examination. His height is 90 kg and his weight is 90 kg and height is 1.77 meter. She gave history of no exercise on most days. Her body mass index is A 20.1, B 24.2, C 28.7, D 30.2, and E 32.4. It's C 28.7. This is calculation BMI. MCQ number 3, the simplest and most practical method of ascertaining the nutritional status of a group of individuals is anthropometric method, biochemical laboratory method, ecological variable method, dietary evaluation method, clinical method. It's E, clinical method. MCQ number 4, a 2-year-old child presented in the outpatient department with complaint of muscle weakness, bowed legs, a large forehead, abdomen for last 1 month. These symptoms may be a result of which of the following deficiency: vitamin A deficiency, vitamin D deficiency, vitamin K deficiency, vitamin C deficiency, and vitamin E deficiency. It's B, vitamin D deficiency. MCQ number 5, stunting is the impaired growth and development that children experience from poor nutrition, repeated infection, and inadequate psychosocial stimulation. Anthropometric index used for assessing the stunting is A, weight for height, weight for age, height for age, and BMI for age. It's C, height for age. MCQ number 6. A 45-year-old man presented to clinic today for a yearly physical examination. His height is 75 kg. His weight is 75 kg and height is 1.8 meter. His body mass index is 23.15 and it is interpreted as thin, overweight, nutritional weight, Normal weight, obese, and morbidity, obese. It's C, normal weight. This is calculation of BMI. MCQ number 7. A 45-year-old female present to clinic today for a yearly physical examination. Her weight is 90 kg and his height is 1.77 meter. Her body mass index is 28. She also gave history of diabetes mellitus and IHD for last 5 years. During her physical examination, this will be the most probable cutoff value of her waist circumference. 70 centimeter, 75 centimeter, 78 centimeter, 80 centimeter, and 88 centimeter. It's E, 88 centimeter. MCQ number 8, a 45-year male patient requiring a bowel resection due to mesenteric artery thrombosis 3 years ago complained of weakness and has symptoms consistent with peripheral neuropathy. He is also found to anemic on laboratory assessment. Which of the following nutrient is most likely responsible for his symptom? Vitamin A deficit, vitamin B, vitamin C, vitamin B12, and vitamin B6. It's D, vitamin B12. Nutritional intake of human is also assessed by dietary method. Method of dietary assessment is most unused method in clinical practice but is recommended for research purpose only in 24-hour dietary recall, food frequency questionnaire, observed food consumption, food diary techniques, and dietary history. It's C.
B.
C. Observed food consumption. MCQ number 10. Which of the following is cost-effective and time-saving method for dietary assessment used in epidemiological studies? 24 hours dietary recall, food frequency questionnaire, observed food consumption, food diary techniques, and dietary history.
A.
It's B. Food frequency questionnaire. This is key for MCQs. This is our YouTube channel. Kindly like and subscribe. Thank you.